Like, what is the purpose of that device?
Imagine push-ups for your lungs, okay? The high-risk patients, the hip surgeries. Why are they the high risk?
The white hairs?
Your high-risk patient.
The bed-bound patients is probably the number one risk of pneumonia. Why? Because just think about this for a second. When you're sitting there, how much are you really breathing? You're
Right.
breathing, but you're not expanding. When you don't expand your lungs, you don't get the proper flow of oxygen. You don't get the proper flow of blood. That's the way that your lungs fight infection. Especially by taking deep breaths, you open up the bases of your lungs, whereas just kind of sitting there and doing this, you don't really open up a whole lot at the bottom. Well, once you build up that fluid, if you're not taking those deep breaths, that's called atelectasis, which is basically just a kind of a fluidity of the sacs down in your lungs. That then turns into pneumonia. Atelectasis is a precursor for pneumonia, basically. When that happens, that usually takes a couple weeks, which goes back to they leave and they come back 2 weeks later with pneumonia. So what this incentive spirometer does is it bases it off of your volume of air. And it's a specific chart bases off your age, height, and age and height. And it basically says, okay, you're this age or this height, you need to be breathing at least 1,500 milliliters every, 4 to 5 times an hour for the remainder of your stay. This allows you to clean your lungs. So to answer your question, the goal is push-ups for your lungs, to expand them, to strengthen them, because you're having hip surgery, knee surgery, you got pneumonia, you're too weak to get up and walk to the kitchen because you're in the hospital bed. So you are now allowing your lungs to fight infection while you're in bed.
Is it a testing mechanism or is it simply an exercise mechanism?
It's more of a therapeutic for sure, but it can be used for diagnostic, given the fact that we are now utilizing data and seeing what happens with it. It's just that it's never been done before. So now that goes back to what we were saying about creating the database filled with successes and attempts, how many times somebody used it, how many times they got to their goal. Because just because you use it doesn't mean you're doing a good job.
Right.
If you don't reach your goal, then you're just using it, but it's not doing anything.
You were talking about how like the high risk patients are your biggest target market.
Mm-hmm.
But it feels like if you can really knock down that gamification aspect of it, like you've got all the hypochondriacs, you have all the people that have the Apple Watches,
Yeah.
the people that track steps, people that track their heartbeat, track their weight, track everything. This is just another thing that they can track. Like, hey, I was at 100% of my breath work every day. Because there's got to be a market for people that do breath work.
Fitbit for the lungs. There
Right.
it is.
Well,
Yeah.
not necessarily Fitbit, but just Fitbit adjacent,
Yeah.
where this plugs into the Fitbit, because you're never going to be able to, I don't want to say never, but compete with an Apple Watch or a Fitbit.
Sure.
But if you can feed the information to it, I think you have a much larger market.
There are so many people that would benefit from this that you may not even realize. People that have COPD that are on oxygen, they're already limited on how much they can expand. They're one of the highest risks for getting pneumonia. People with asthma, people that have, emphysema or any other lung disease. This now has actually, you can go into cystic fibrosis in children. You can go into sickle cell anemia. You can go into trauma patients that have rib fractures. I mean, it's limitless in a sense of how many populations there are, but it all goes back to lung infections.
Mm-hmm.
So to answer your question, yes, it's really about the lung infection, but to pull back, how many people are constantly getting these infections for whatever reason? And again, I just named off 5, 6, 7 of them, but I mean, it's so many. So the endpoint is prevention, but the patient population can be almost any population that you can think of.